What's going on, everybody? You're tuned in to another edition of our No Time for Talk, Just Time for Action podcast. And today I'm going to bring you guys another mental health resource. This is, I guess, a crisis line, a new crisis line that's going to be launching. So we're going to get into the transcripts of that and kind of what that's all about. But if you guys can, before we go into everything, if you guys can, just please like, share this channel, No Time for Talk, Just Time for Action podcast. Really help the channel grow, really support. If you want to support the channel, that would help us out. So without further ado, let me share my screen with you guys. And here we go. So this is the new 988 is the new 911 for mental health. They did podcasts on this. I'm just going to read the transcripts, but if you guys want to check that out, looks like Podcast 360, 988 is a new 911 for mental health if you guys want to listen to the whole sound. But basically, this episode is about the new 3-digit code for people experiencing a mental health crisis starting July 16th, 2022. People can call or text 988 to be connected to mental health professionals. So we have Jessica Bard here, who's introducing herself to the Podcast 360. There's a new 3-digit digital dialing code for people who are experiencing mental health crisis starting July 16, 2022. People can call or text 988 to be connected to a mental health professional. Dr. Margie Belfour is here to speak with us today about the upcoming implementation of 988. She's a psychiatrist, the chief of quality and clinical innovation at Connections Health Solutions, and a professor of psychiatry at the University of Arizona in Tucson, Arizona. She goes on to say 1 in 4 adults in the US will be experiencing some sort of mental health issues or a need in any given year. And then with COVID, those numbers have been increasing and people coming into the emergency room, especially young people with suicidal thoughts, is one of the fastest growing segments of the ER visit in recent years. And so the loneliness and the isolation and the stress of work and finances and losses just really created even more mental health needs. So as far as the 988, what's the who, what, where, when, and why? How is this going to help people? 988 is going to go live July 16th. So just in a few weeks, as it's created to have a hotline for 3-digit emergency number for people who call mental health emergencies, particularly suicidal thoughts, because currently people call 911 and that usually results in a police response. And that's not what people in mental health crisis need. They need to be connected to clinicians who can take care of them and help work with them through their crisis. So it's going to be a 3-digit number nationwide. It links to current national suicide prevention lifeline networks, which is a network of over 200 crisis call centers around the country. But this will link them all into one network and also bring in other call centers, eventually link into 911 in many communities so that when people call the number for help, they're getting someone who can provide resources they need. That's pretty good, 988, all right. But also finding ways to look at data that actually has impacted different parts of the population. We've seen an increase in depression and anxiety, which is not too surprising given how I think everybody's felt a little anxious during the pandemic, but there's actually a bit of disparity in terms of race, ethnicity, and socioeconomic status. There was a study done in Maryland. Let's see. Definitely affecting different parts of the population, and some due to loneliness and isolation. Let's go a little bit forward here. I mentioned to some collaboration, but really talk to us about the importance of collaboration in solving mental health crisis. The mental health crisis, when you think of 911 today, you can't really think of it without thinking about the emergency response systems that come behind it. So your 911 call takers, the ambulance, the EMS, and the emergency rooms, we need that kind of response for mental health crisis as well. Right now, we often rely on the police to respond to take people to emergency rooms that aren't equipped to handle what people need, or worse, police, they don't really have the place to take them. The emergency room often makes them wait for hours with people, and so jail becomes a path of least resistance. Mental health crisis response is really about building the response that's going to address the person's mental health or substance use need and get the right kind of response to them. So they will call a 3-digit number and get the clinician who knows how to work with people in crisis, knows how to help people resolve their emergency, and then if they can't do that over the phone, be able to link them to the right care that they need. So that means mobile crisis teams that can come out where the person is and be able to address their crisis and help them figure out what they need to be able to remain stable. But if that's not possible, then bring them to the crisis center where there are multiple multidisciplinary staff. So anywhere from psychiatrists to nurses, social workers, but also people have their own lived experiences with mental illness and can help work with them and try to get that crisis stabilized. Ultimately, because different people, they may manifest their mental health crisis differently. And so one thing you want to look for is a change from how a person normally is. So someone who's usually exacerbated ends up spending a lot of time isolated and alone, or someone stops doing the things that they used to enjoy. Those are big warning signs. If someone who used to sleep a lot is now not sleeping very much, or someone who used to like to sleep a lot is now wanting to sleep all the time, changes their appetite. Those are big signs. So again, you guys can read all this. My basic portion here is I want just to provide you guys with another resource out there that is going to be launching very here shortly, July 16th. So if this is something that you feel somebody needs, and it's another resource out there that definitely may help somebody with a mental health, substance abuse crisis that can possibly save somebody's lives. So that's what I got for you guys today. So again, 9/8/8, July 16th, looks like when that's program starting. So another resource out there to help you guys with, mental health, substance abuse issues, or at least somebody who can definitely point you guys in the right direction. Let me know what you guys think in the comments. Post in the comments if you think this is a good idea, bad idea, or if you think it's what we need out there. As always, please like, share, subscribe. No time for talk, just time for action podcast. Thank you and God bless.